So hello and good afternoon, everyone. I think we'll get started now. It's 4 minutes past 12. We've got a good number on already. We expect a few more, but they'll join in. We'll also make a recording of this so that it will be available to anyone who wasn't able to make it. And a very good afternoon to wherever you're calling from. Some will be calling from practices, or many of you, like us, will be calling from their homes. We were thinking about having a sweepstake to see whose child would walk across the screen first, but we'll hope that those sorts of occurrences don't happen. But welcome to a first in a series of webinars where we'll be showcasing some of the fantastic partner products that we have now available through EMIS, and how they'll help to add value to your EMIS web system. My name is Jamie Cole. I work within the EMIS Partners team, and I'm joined on today's session by three colleagues. We have Izzy Piers, who's our digital marketing lead, who's helped to set up today's session. Nathan Savory, who's one of our technical architects, works with our sales team and also with our customers to help identify your needs and requirements. And also Munib Hanif, who's one of our product architects, who helps to test all of the systems we have and will be taking you through a demonstration. So a quick word about the agenda. On the next slide, I'll cover off a little bit on the changing role of telephony in the current situation and environment we find ourselves in. I'll pass over to Nathan, who will give you a bit more of an introduction into Surgery Connect, what's included as part of that service. We'll then pass over to Munib, who'll take you through a demonstration. It's a comprehensive product with lots that we could focus on, but we're going to cover off a couple of key areas that we think will be important to you, and we'll look at some of the important features such as signposting callers with voice prompts, caller verification so that you can help to triage potentially vulnerable COVID patients first, and simple things like click to dial from the patient record. Then hand back to Nathan, who will cover off what's included in the service so you can see that everything is part of it. Please feel free to ask questions throughout. I think you'll all be on mute, so we won't be able to hear you if you talk. But if you do have an unmute button, if you could stay on mute, that would be much appreciated. You should have a toolbar where you can simply add questions into the message. We'll try and answer them partly as we go via text, and if we've got time, we'll answer them at the end of the session. For any we don't get to, or that we can't answer immediately, we will of course follow up afterwards. So this slide that you can see in front of you now, I think, and the image, I think, says a lot about the current situation that we find ourselves in across the country. When we first began looking at arranging this webinar back in February, we planned to talk about on-site installations with reception desks, administration wallboards, and lots of handsets in consultation rooms. But daily life, as you are acutely aware, has changed significantly. And as you can see in the image, you can see the practice visit consultations have plummeted and the corresponding rise in telephone consultations. So this need for a secure and flexible telephony service to support your remote and distributed workforce is really now more than ever an essential part of your operations. And for many practices, the current solution is to use mobile phones. But as you'll be aware, there are many challenges with that type of approach. So simple things like battery life, signal strength, ease of use, potentially high call and SMS costs, potentially some privacy concerns. So if you have patients' numbers on personal mobile phones, that's a potential privacy issue. If you withhold your number, there are patients, and perhaps some of you as well, that don't answer withheld or unknown numbers, so you could end up with a lot of back and forth trying to make contact with patients. And actually, Nathan and I spoke to a client yesterday who's part of the practice lead team, who were talking about actually struggling to manage with limited lines and limited visibility of what's going on around their practice. So now the scene is set, I will hand over to Nathan. He'll describe how the Surgery Connect solution helps to address some of these challenges and offers a flexible option for you, both for practices that are coming to the end of a current contractual term and wish to move to a new service, but also those that are still in a contract but need a temporary solution now, so it can sit alongside your existing infrastructure. Thanks very much. I'll hand over to Nathan.
So, good afternoon, everybody, and thanks for joining. I'm just going to go through a bit about the solution and what makes Surgery Connect award-winning. So, as you can see here, we have unlimited lines for inbound and outbound calls. Traditionally, what you would get with a traditional line, an on-premise solution, is you'd have a maximum of 2 lines. So if you're paying for 2 lines, you only can make 1 outbound call and 1 inbound call without any scalability, without being charged further lines to be able to get what you want. What we provide is unlimited lines, so you can make as many calls as you wish, and then as many calls coming in as well, which we can manage on the solution. Because you've got the unlimited calls and also the call recording as well, part of the solution, it means there's no additional cost for that feature. Normally what you would find is you'd be paying for those additional features added on top of your bill, just to gain specific features. But what we do is we wrap it up in one solution as a managed service, and we provide the full solution, so you guys don't have to worry about that. We provide the advanced handsets, we provide the backup mobiles which come with the reception handsets, and we also provide the support as well. Now, not only do we provide support, we provided a sophisticated EMIS web integration feature. Now, this feature is there to save you a lot more time instead of being able to toggle between EMIS web and the actual solution itself. So you can actually click to dial, which we'll talk about in a bit more detail. So I'm just going to go over to the next slide. So basically, just to touch upon some of the key features that we've currently got on the actual solution itself. One of the best features that we do have is the central dashboard. So we provide you with a central dashboard where you can actually access all the different features within the solution. We also provide a user console, which is very user friendly as well. We provide SMS templates for the actual SMS messaging service that you guys will have currently sat within EMIS. So it's provided free, but we'll go over in a bit more detail about that. And we also provide calendar as well. So we understand a lot of practices have meetings weekly to just discuss various things. Now in the calendar, what this allows you to do is input a day where you've got training or if you've got a meeting without you automatically manually having to do it yourself. So we automatically do that and input that information in there, but we also give you guys the keys to be able to do that as well. We also provide call recording as well. So you guys can actually pause the recording, or if you guys want it to resume, you can do. There's no additional cost for that. Exflow distribution, which we'll talk about in a bit more detail of how it's managed. Self-service, management reports, which can be sent to you automatically weekly or how often you guys would want them. And we also offer voice prompts as well. Handset modes, queue busting, and no appointment mode. Now, the reason why we provide these features is to ensure that you guys are getting the very best from the solution. So if you look at it from a highlight point of view, you've got no more engaged tones for patients. Your outbound lines are always available to making calls. You can free up the receptionist time. So on an average afternoon, you can save a week, improve DNAs, and pay for your phone system as well, without having to put an upfront cost for a new system. We reduce the time spent on the complaint management side of it as well, which will help your patient's experience. And you'll be able to know your call stats and staffing levels from that as well, from the reporting element. Now, just to give you a peace of mind, the system is reliable, it's robust, and it's a brilliant system. It's been tried and tested, and in this current time now, part of the COVID, business continuity is one of the most important things that a lot of our practices, federations, CCGs are talking about. And we're going to understand from your point of view as well, from a practice point of view, this is something that you guys do require. Now, we've partnered up with a company called Xon to provide this service. Now, they've got 18 years of experience in the cloud telecoms market and the healthcare industry. Now, the reason why they've partnered up with us is because we've got a lot of experience within primary care as well. So I'm just going to pop you over to my colleague, Manib, and he's going to go over some of the actual slides and the demos with you from the actual solutions point of view. But just moving on to the next slide, Manib's going to go through the management page flow from an EMIS integration point of view. So what you can see here is part of the features within EMIS Web. So you'll be able to verify the caller with the Popup ID. You'll be able to locate patient records and book appointments. You'll be able to review and play back associated call recordings as well. And you'll be able to send SMS appointments notifications through the system itself. But also as well, you'll be able to make a call from within the patient record, which will save you a lot of time. So it's just click to dial. So I'm just going to move you over to Manib now, and he's going to go through the actual features within the solution, so you get a visual idea of what it looks like. I'll just pass you over to Manib. Thank you.
Thank you very much, Nathan. Good afternoon, everybody. As just to recap on what you've already been told. So the Surgery Connect platform is quite comprehensive. There's quite a lot to it. So we're not going to cover everything today because unfortunately that's not possible, but we are going to cover some of the key features which we think would be really helpful and be really informative to yourselves. So just to split those into two categories. So one of the first elements we're going to focus on is the Surgery Connect EMIS Web integration. And in addition to that, we're then going to focus on the Surgery Connect administration portal, otherwise known as a dashboard. So what we've prepared today is a bunch of clips, video clips, which should hopefully be short and concise and should be quite informative and should be able to demonstrate to you the capabilities of Surgery Connect. So we'll move on to the first slide. So one of the first features that we're going to look at within the Surgery Connect EMIS Web integration is the Popup ID. So essentially what this feature is somebody would call up a patient, typically a registered patient would call up the surgery, and their details would pop up onto the, for example, the receptionist screen. I'm just going to play a short clip which will demonstrate that. So what we're going to see here in just a moment is an example of what a receptionist might see on their screen when a call comes through. So if there's a particular patient that's calling and they're registered at the practice, their name and their date of birth information, along with their contact number and several other bits of information would come through. So this integration piece is quite helpful because in a busy environment like a surgery, it does help to save time in trying to verify who's calling and bringing up the patient's details through conversing with them. So it speeds up and it helps drive efficiency in a busy working environment. So hopefully that gives you a little insight into that first feature. So we'll move on to the next feature, which is called the call association feature. This is somewhat of an extension to the Popup ID. So as we just demonstrated, so a patient would call through and they would their details would pop up onto the screen. They would then converse with the staff member at the surgery, and at the end of the call, this next feature is what would appear for the staff member. So essentially what we would see is the feature in the bottom right hand corner would appear at the end of the call, and what this allows the user to do is save a recording of that particular conversation, which is saved for a period of 36 months. So you always have access to that particular recording. If you ever need to refer to it for auditing purposes, you can always do that. So just moving back a little bit again. So what you would see, you would click yes if you wanted to actually save that recording, and no if you didn't want to associate that particular recording. So I think that's a very handy feature and something excellent that Surgery Connect have put together, and can be really helpful for the surgeries themselves. Moving on, to the next slide is the call. Again, it's an extension of the call association. This example is going to just demonstrate a previous recording that would have been saved. If you wanted to actually listen to that, what that would look like. So we'll just go ahead and play that as well. So what we're seeing here is the patient overview screen, which is one of the main interface screens that you would deal with as part of the integration of Surgery Connect and EMIS Web. And the screen that we're interested in looking at in this particular example is the call log screen. So what would typically, if you want to listen to an example call, you'd click on the call log screen and a call recording would appear. You'd click onto the listen button and then you can just listen to the playback of that conversation. So really easy to access. So once the recordings have already previously taken place, it's not a difficult task to try and retrieve those. It's actually very easily available from the patient overview screen. So hopefully that gives you a quick demonstration of what that looks like. Moving on to the next screen. So in addition to just being able to see the recording that appears initially when you click on the call log screen, you can also search further back in a date range to see if there's any other recordings that may be present that you can access. So we're going to have a look at this example here. It's similar to the other one, but it just expands on it a little bit further. So you click on the call log option, and as you can see, we have a filter option here, and it allows us to filter by a particular date. So in this example, we're going to put a custom date range in here of around a 3-month period. And once we apply that, it will bring back within that date range all calls that have been recorded and associated. And again, very easily you can access them and have access to call recordings that have been taken. So hopefully that's very helpful. Moving on to the next feature is the ability to send SMS text messages via the patient overview screen. So we know that in this day and age, SMS text messaging with surgeries is one of the most effective and one of the most used functionalities out there. So I'm sure lots of people experience receiving text messages about reminders, etc. From their GP surgery. So built into the Surgery Connect platform is the ability to send SMS text messages very easily. So we're going to play a quick demonstration of that for you as well. So what we're looking at here again, the patient overview interface where you would use most of the features. We were interested in looking at the SMS log in this particular example. So we click on the SMS option and we can choose from an existing template, and we can give that a condition as well if we like, and then we can send that message very easily. As you can see, that would then send a message straight away to the patient. Again, if we don't want to use a template, we can just do a freehand message. We can write that out, and when we're happy with it, we can just send it out to the designated telephone number there that you can see, and that would instantly go out to the patient. So really quick, really easy. There's not much difficulty in that. Just probably aids in driving efficiency in a busy area and in a busy environment like a GP surgery. Moving on to the next slide is the SMS log search. So this is giving you an example similar to the call association search that we looked at earlier, but here we're looking for examples of previous messages that have been sent out via text for an example patient. So we'll play the quick demonstration of what this would look like. So we'd click on the SMS log and we would specify a date range that we're interested in looking between. So wherever this example might be, probably a couple of months. And we apply that, and we can see a log and an audit of all the messages sent in between that particular time period for that particular patient. So for an environment that requires auditing things and making sure that the things are in check. You have access to all these functionalities to be able to look at information at real ease. The next feature we're having a look at is the click to call feature. This particular option is again really handy in a very busy environment. So typically in the surgery, if you're really busy, you want to be able to do things quite quickly. What this feature allows you to do is allows you to call the registered patient that you're looking at just at the click of a button. So I'm going to play this. There's not going to be much to see because we're not making a live call right now. But essentially what you would do is you would click the call button. This would dial out to the patient. And once this starts to ring through, it would then alert your handset at your desk to say that the call has gone through, and you would pick the handset up and then just open up a conversation with the patient. So instead of having to manually look for the phone number and pick up the handset and then dial the number, etc., again, a key feature that just helps to cater towards efficiency. So well put together in the Surgery Connect EMIS web integration platform there. So hopefully those features there have been handy and helpful in giving you just a brief insight into how well Surgery Connect and EMIS web work together and help to drive efficiency and make things much more seamless. So next up, we're going to move on to the area of the system of Surgery Connect, which is the administration dashboard portal. There's lots of features in here, but we're going to just filter down and just walk you through a few key areas that might be of interest to you. So one of the first areas that we're looking at here is the Xflow feature. So essentially, this might be used typically by an administrator of the system who wants to design or put together what a call journey would look like for a patient when they actually call through. So what we're seeing here is maybe an example of a workflow and a diagram of what we want a patient journey to look like. So this is showing here that a patient would call up and they would be prompted with a welcome message, and if the surgery is closed, then they'd get an announcement and the call will end. And if the surgery was open, they'd go through a timer and then go through to a main menu option. And from there, they would hear the several menu options, and they would choose one that's more specific to them. So, for example, the appointment menu. Once they click on that, they'd hear further messages, and then they'd route through to the option that they would choose, and then hopefully get through to the correct area. So this is just demonstrating what a design will look like, but just going to walk you through what the Xflow feature looks like on the dashboard in the backend portal, where you would design an Xflow according to your requirements. So this is the screen that you would find yourself at if you were to be experimenting or designing the Xflow in Surgery Connect. And this particular example, we're looking at an existing Xflow that's been put together, but we're just going to look at a snapshot of what it would look like if you were going to make some changes in this area and add something additional. So I'll just play this, and hopefully it will be a little bit of an insight for you. So we're looking at adding in here an additional group into the existing workflow. And what you would do is just drag out the group option, and it will give you a list of groups. So we're going to choose from an existing group called test group. And once this loads up, it will appear on the screen. And what we'll do at this point is we would associate that particular group to an option that we've already designated in the menu option. So in this example, that's the nurses option. So what this would mean, if somebody calls through, they would hear a menu option, and if they heard the nurses option, they'd select option 4, and that would direct them to this particular group that we're setting up here. And at this point, what would happen is either the call would time out or it would fail, and then eventually the call would finish, or if they were to be transferred successfully, they'd hear a whisper and then go through to the correct area that they desired to go through. So this is just a glimpse of how you would put this together in the Xflow section. So with some training and some practice, somebody can become proficient and have the ability to design this and put this together according to their requirements. So it's an extremely powerful tool. It gives you a lot of power in terms of how you actually want your call routing system to be designed within your surgery, all at your fingertips. So hopefully that's been of some help to you. So in this slide, we're just looking at some of the features, some that we've already looked at and some we're going to look at just moving forward. So we've looked at, briefly touched on the Xflow feature. We're going to look at some areas that cover reports. We're going to look at an area, the Wallboard feature, and a really good feature is the queue busting feature, which hopefully people will find quite interesting. So we'll move on. So again, these next slides are all demonstrating different areas of the Surgery Connect Administration Portal dashboard area. So we're just walking through what different areas of the dashboard look like. So in this slide, we're looking at anybody that's interested in, initially, we're going to look at first running reports. So there's a section here in the portal where you can actually run reports, and they're grouped into different areas. So you can run reports regarding calls or groups that you've set up, or user reports, management reports. In the example here, we're going to look at a report around call reports. So we're looking at here the inbound call stats report. So the way you would filter through what you want to see is you select the number that you're interested in running a report for. So we're just going to select an example number here, and then specifying a date range as well. So you specify a date range according to your requirements. You apply those options and then you click on generate report. And what we're seeing here is some results that come back. So you would see a total number of calls in that time period, broken down in an hourly basis, and the average call duration, and the total call duration as well. And you can see that in a graph format on the left hand side. For the right individual, this piece of information would be really helpful. So typically somebody in management, somebody who's interested in looking at statistics or finding out where there's inefficiencies or efficiencies, etc. This would be a really good feature and for them. You can also export the reports to CSV. So in an example here, we're looking at it going straight into an Excel format. So for the right people, this is just a really good option to have. And you can see the results there in the Excel sheet. So hopefully that's been a little bit of an insight for you. The next example that we're going to have a look at is the calendar option. So as Nathan touched up earlier, there's lots of things that you can do with the calendar option in Surgery Connect. You can make changes within there that would then affect your call routing, etc. So just to not overcomplicate things but keep things simple, we're just going to have a look at the following example, which is going to demonstrate what it would look like if you were to book a holiday into the calendar. So I'm just going to play that and hopefully talk you through that a little bit. So in this example, we're going to look at booking in a holiday on Friday. And what you would do is you drag out the holiday option to Friday, which would open up the prompt where you would filter through how you want to design your holiday. So there's a number of options here. You can put in holiday for a full day or for a partial day. We're going to stick to a full day here for the purposes of the example. You can also have this as a one-off event, or you can have this as a repeat event. Again, we're going to just keep this as a repeat event in this particular example. You can also signify whether you want this for several days or just for one particular day. we're going to just leave the option as Friday in this particular example. And then you can also specify what the start date is that you want this holiday to be on. So once you're happy with all those options, you would apply those changes by saving it. And what you can see here is the change immediately takes effect. So that Friday is now booked in as a holiday. And just to test, because we did say we were going to repeat this, it should show every subsequent Friday as a holiday as well. So it means there's less repeat work. You can really use this to your advantage. You can make a change once and make sure it's replicated over and over again. And what this would mean for somebody who's calling through a patient to the surgery on that particular Friday, they would hear a message that the surgery is closed, due to holiday or whatever you would signify that the message to be. So one change allows you to be able to communicate that to all your patients as well. So really handy feature. There's lots of other features on there as well, but it's just to give you a quick glimpse of what's available at hand here. The next option that we're looking at here is the Wallboard option. So we know that surgeries are busy at different times of the day. Lots of things are happening. So a handy feature to have in front of you is a monitor screen where you can actually plug in a Wallboard, which is in this example, we're showing that Surgery Connect has that capability. So you could rig this up to a monitor screen and you would see information like how many users are available, how many calls are coming through, how many calls are queued, what's been happening throughout the day. And this is live information, so it would change from moment to moment. So if you have this in front of you, it gives you that advantage and that ability to be able to respond to things as they're happening in the moment. So you can imagine when you don't have this in front of you, you don't have a glimpse or a clear understanding of what's going on, but something like this can be really helpful. It can make you just work much more effectively at the right time. So hopefully that's been insightful for you. The next option feature that we're looking at is the user console option. This is has very similar to the dashboard. So an administrator would typically use this area so they can see what's going on, and typically this does include some of the Wallboard features. It has other features in there as well, but in the example we're just going to touch up on if an administrator was to administer another user of the system, what that might look like. So I'm just going to play that example for you now. So if we select a user of the system in here, we can see several options that we can come up on the screen. So we can see options of switching them between the numbers that you want to associate them to. You can change their status to make them available, log them out of the system, designate them to make outbound calls. You can see they're associated to a bunch of groups in here as well. You can disassociate them or associate them depending on what's required at the given moment when you're actually making those administrative changes. So hopefully this gives you a glimpse of what this area of the system can do. And we'll move on to the next piece, which is the configuration console. So this area of the system is probably one of the most powerful areas. It's an area where you typically do most of your administration changes, adding things, etc. So quite a core area. We can't cover everything, so we're just going to again have a little snapshot of what this can do. We're going to have a look at a piece similar to what we covered earlier in relation to the SMS feature. In this area, we're going to look at how an SMS template that we would use in the integration is set up. So it would be set up in this area of the system. The example is going to just give you a little walkthrough of what that would look like. So just rewinding back, sorry. You click on the view option in SMS templates, and you can see a bunch of templates that have already been set up, but we want to set up a new one just to give you a demo. And this is what the layout would look like in the screen where you would set up the template. You'd give the template a name. There's also options to be able to insert fields into the message body. So we're just going to add in a few just for the purposes of the example. We can also give the select a condition that might be related to the particular template, and we can also freehand text message as well if we want to add on a personal message or tailor it to exactly what we need. And so the example is just showing you what that would look like. And you can select a condition, any condition that you want. And you can preview the message before you say the template before you save it. If you're not happy, you can always make changes. If you are happy with it, you can just go ahead and save that as well, which the example will show in just a moment. You can add additional conditions as well if they're not already in the list. And once you're happy, you click on save, and that will just add on to the rest of the templates, and then it's available for you to use in the integration element that we looked at earlier on. So again, the configuration console, there's lots you can do, and that's just one particular example of what you have to hand and what kind of tools you have to make your life easier in the surgery. So the next piece that we're going to look at is the queue busting option. A lot of times what we find, and it's a common known problem, that we have lots of people trying to ring up surgeries, typically on a morning, not being able to get through. We have surgeries that are inundated and bombarded with calls that are coming through, and they just have high queues that are through the roof. So Surgery Connect have developed quite an interesting and probably a helpful feature for many people out there, which allows patients to call up to the surgery in the morning, and if they are in a long queue, they will hear, as this particular diagram shows, they will hear an option for a callback. So they'll hear a message saying that you're in a queue. So instead of staying in the queue, what we'll do is we will call you back once you are towards the front of the queue. So please keep your phone to hand. And once they get towards the front of the queue, say the second person in the queue, they will receive a call back onto their handset. And once they get to the front, they'll be put through to the member of staff at the surgery. So this is just probably a big game changer in a way for patients who they don't have to be frustrated hanging on to the call onto the phone for absolutely forever, and also for surgeries as well, not having queues of calls through the roof at any given moment of time. So I'll just walk through the back end of what this would look like if you were to set this up within Surgery Connect, and how you would activate this. So again, this feature would be activated in the Xflow area of the system. Excuse me, just gonna play the example for you. And what you would do in this particular area is you would target a group that you're interested in. So if it was an appointment group, you'd select an appointment group. What you would do is you would double click that particular group. So here we're looking at the test group. And when you double click on it, you get to the edit section. And what we're interested in looking at is the queue busting option. We would click onto there, and we would then see the options of how we would go ahead and make this tailor it to our needs. So at the moment, the queue busting option is shown as off. To ensure that this is activated, we click on the drop down and we'll click on the imposed or voluntary option, which would activate it. The threshold is the number of calls that you would want to have in a queue before this particular option becomes activated. So here it's 20. At 20 calls, anything above that, queue busting would be activated, and then patients would start to hear the message that they'll be called back. The introductory prompt screen is where you can signify what message you want them to hear. So in this message, it's just telling them that they're in the call queue and they'll be called back, and please keep your handset to hand. You can hear the preview. Unfortunately, in this example, we can't, but you can listen to it to hear what it sounds like before you're happy it's going ahead with that particular prompt. And in addition to this, there are further options that you can select. So we have the an option where you can send a text message out. So if for whatever reason a patient didn't receive a callback, or they didn't pick up their handset when they were towards the front of the queue, you can set up an option where you can send SMS messages out. So if you click yes to the SMS option, you can then for example, this message would send out saying, we were unable to contact you. If you still need us, please contact us. Once you're happy with everything that you've set up in there, you click on save, and it's as simple as that. That will activate that particular group. Queue busting will be activated for it, and hopefully, lots of people find this feature very beneficial. So hopefully that's give you a little insight to that as well. So that's the demonstration. It's only a small area and small pieces that we've covered of the platform that we're demonstrating today. But hopefully it gives you a snapshot of what you would have to hand, what kind of powerful tools you would have to hand if you were using the Surgery Connect platform. I'm just going to hand back over to Nathan now, and he's just going to cover over a few points for you as well. Thank you very much, everybody.
Hi guys. Just to give you an idea of what you would receive part of the solution, as you can see here, you would receive, for business continuity, we thought it was very important that we provided a mobile phone for the receptionist handsets. So what we provide is the handset, the headset, and a mobile phone. This comes with all the reception extensions. So for business continuity, so if you look at COVID-19 situation at the moment, where a lot of us are working from home, we'll be able to pair the actual handset to the mobile phone. So you guys don't lose any service, your patients still can come through to you, the patients don't know a difference between calling into the actual practice or if a receptionist is working remotely from another location. We also provide the standard extensions as well, and we also provide cordless extensions. But the reason why we provide specific handsets and the hardware is just to make it a lot easier. So if you look at why would you choose a cloud-based telephony system, one, you've got less hardware and no on-site maintenance needed, whereas traditionally on an on-premise solution you'd have a PC sat in the corner which would use electricity, and it would have to be serviced from time to time, and you'd probably get a charge for the actual hardware being serviced as well. But because we provide the actual hardware, we provide warranty with it in place for duration of the actual contract. So we offer a minimum of a 5-year contract, and we also provide scalability, whether you're scaling up or down based on an extension. So if you've got additional handsets that you need to add on because you've got more admin staff, or you've got new GPs that have joined the actual practice, we can add them onto the current contract. And we only charge £25 per handset. So there's no additional cost for the actual solution itself. What you see is what you get. And in terms of upgrades and updates, the entire Surgery Connect product is designed to develop in-house by our development team to ensure any improvements that we do put out there, you guys get the benefit of it. So basically, there's no extra charge for that. We just update the system. Now, in terms of resilience and the backup mobile phones that we actually supply with extensions, to cover internet outages, you can log into personal mobiles or from another landline with the same solution. We can also use the actual system through dual site resiliency as well. So on all platforms with servers. We can add personal touch on there for each site as well. And we'll also provide a dedicated account manager to go through the actual configuration and the definition process of what you guys would require it for. Now, the best thing about the solution itself is the local call costs. So you've got unlimited calls to UK landlines, mobiles, or if your rental should ever fully cover all of your outbound and call activity, we would do that for you. So from a GP forward view, we address many of the suggested actions outlined in the GP forward view study. So any additional feedback that we receive from sites, we would take that upon ourselves and do something about it. So just moving on to the next slide now, I'm just going to explain a little further into the actual service that we provide, because what you'll find is a lot of on-premise solutions, they don't provide you with a gold standard service. So from a service level agreement, we provide gold standard straight away. And as you can see here, we give you an indication of the times that we'll actually respond to, the time of the fix, and basically what we'd do. So basically we'd raise the ticket and we'd escalate it appropriately. And obviously the normal support hours is from 8 AM to 5:30, Monday to Friday. And if you guys have got any questions or feel that you guys need to escalate anything outside that area, you can escalate it to myself. Have you guys got any questions based on the actual solution that you've seen so far? Feel free to ask any questions, but I thought I'd also let you guys know as well, a lot of our customers that we have, primary care. So we have a lot of practice-led customers. We have a lot of customers through federations, CCGs, and they all work collaboratively together because they all have one goal, and that's to save time and being able to move forward digitally. What I will also do as well is I'll publish the actual link in the actual live event Q&A section, so you guys will be able to see. So if you want to have additional information on the actual product itself, I'll put it on there so you guys can click on that, and then I'll follow that up with you guys to discuss it further for individual sites. So as you can see in the Q&A field, we've added it there, my colleague Izzy. I would like to thank everybody that's joined today, and I can understand a lot of you may be coming out of a contract or be looking at investigating a new telephone system. Feel free to give me a nod if you guys want any additional information, and I'm happy to speak to everybody about the actual solution itself. So thank you for your time, and I look forward to hearing from you all.
Thank you.